What if the cure hurt more than the disease? What if healing meant drilling into your skull, or celebrating a wound filled with pus, or trusting a doctor whose very mask symbolized death itself? Medieval medicine wasn't just primitive, it was a world built on fear, faith, superstition, and desperate attempts to understand a body no one had ever truly studied. In this video, we uncover 3 of the darkest medical practices of the Middle Ages and what they reveal about the human struggle against the unknown.
Chapter 1. Trepanation, drilling into the skull to release demons. Imagine lying on a wooden table while a surgeon sharpens a circular iron blade. You're fully conscious. There is no anesthetic, no sterilization, only the sound of metal against metal and the weight of hands holding you down. In the surgeon's mind, he isn't just treating an illness, he is battling a demon trapped inside your skull. Trepanation, drilling or scraping a hole into the skull, was one of the most widespread surgeries in the Middle Ages. It was used to treat migraines, seizures, hallucinations, madness, and traumatic head injuries. But the core belief behind the operation was spiritual, the idea that evil spirits cause mental disturbances, and opening the skull allowed them to escape. The tools were primitive, but terrifyingly effective. Knives, chisels, sharp circular saws. Surgeons scraped through the scalp and bone until the soft membrane covering the brain became visible. Patients who screamed or convulsed were seen as proof that the demon was resisting the procedure.
What's astonishing, however, is that some people survived. In cases of head trauma, trepanation unintentionally reduced pressure inside the skull, preventing fatal swelling. Archaeologists have found medieval skulls with healed, neatly rounded openings, evidence that the patient lived long after the procedure. But many others died of shock, blood loss, or infection. To medieval healers, these deaths were not failures, but signs that the demon was too strong or that the patient's body had already been corrupted. Trepanation reveals a chilling truth about medieval medicine. When you don't understand the brain, you try to open it, even if it kills the patient.
Chapter 2. The Cult of Pus, when infection was a cure. In the Middle Ages, a wound full of yellow, foul-smelling pus wasn't the sign of something going wrong. It was a sign of success. Doctors believed in laudable pus, the idea that infection was a healthy and necessary stage of healing. A dry, clean wound worried them. They wanted inflammation. They wanted swelling. They wanted the body to ooze. To encourage this, surgeons often applied irritants, dirty cloth, contaminated herbs, mixtures containing mold, soil, or animal hair. Bandages were reused across multiple patients. The more the wound reacted, the better they believed the healing process was going. This practice was rooted in the dominant medical theory of the era, the 4 humors: blood, phlegm, yellow bile, and black bile. Disease meant imbalance, and infection was interpreted as the body expelling the corrupt humors through heat and swelling. A wound that stayed clean wasn't purging anything, and therefore wasn't healing.
The consequences were devastating. After amputations, patients were wrapped in filthy bandages soaked with old blood and bacteria. Instead of preventing infection, surgeons were intentionally creating it. Many patients developed septicemia, gangrene, and fatal fevers, deaths entirely caused by the treatment itself. The first major challenge to this deadly belief came not from Europe, but from physicians in the Islamic world. Thinkers like Avicenna described the dangers of infection, recommended sterilizing wounds with alcohol, and emphasized the importance of cleanliness. But in most of medieval Europe, these ideas were ignored or misunderstood for centuries. The cult of pus persisted because medieval doctors weren't looking for germs, they were looking for signs of the body balancing itself. And in mistaking the disease for the cure, they celebrated the very thing that was killing their patients.
Chapter 3. Plague Doctors,
The most misunderstood figures of the Middle Ages. A long black robe, a wide-brimmed hat, a beaked mask that looks like a creature from a nightmare. The medieval plague doctor is one of history's most recognizable images, but the truth behind these figures is far stranger and far more tragic than the legend. Contrary to popular belief, most plague doctors were not highly trained physicians. Many were unskilled volunteers, or people forced into the job. Cities hired them directly and paid them a salary to treat anyone who needed help during outbreaks of the Black Death. Their contract often included one grim clause: they couldn't quit, even if the plague spread to their own household. The famous beaked mask wasn't meant to be frightening. It was a primitive air filter. Medieval medicine believed that the plague spread through miasma, toxic air. Doctors stuffed the beak with herbs, spices, vinegar-soaked sponges, or dried flowers to purify the air they breathed. This did nothing to stop the bacteria itself, but it may have slightly reduced exposure to fleas, providing a small, accidental layer of protection.
The rest of the outfit, the waxed leather robe, gloves, boots, and hood, formed one of the earliest full-body protective suits in medical history, not because doctors understood germ theory, but because they knew the plague passed from the sick to the healthy through contact. Plague doctors used wooden canes not to fight off patients, but as tools, to lift clothing, point to areas of the body, or keep people at a distance. They documented last wills, drained buboes, applied poultices, attempted bloodletting, and often watched entire families die within days. Most plague doctors didn't survive the outbreaks they worked in. Their suit became a symbol not of authority, but of death, a walking reminder that the Black Death spared almost no one. Yet, despite the fear they inspired, these doctors were among the only people who dared to confront the plague face to face. Their methods were flawed, their theories misguided, but their bravery was undeniable.
Conclusion. Trepanation, the cult of Paus, the plague doctors. These practices may seem barbaric now, but each one reflects the same human instinct, the desire to understand suffering in a world full of uncertainty. Medieval healers operated with limited knowledge, guided by superstition, ancient theories, and religious beliefs, but they were often the only hope people had. The Middle Ages were dark, but they lit the first sparks of the medical revolution. And through these strange, terrifying practices, we can trace the earliest steps toward the medicine we rely on today.